A 55-year-old man with a history of hypertrophic cardiomyopathy presents with recurrent episodes of syncope. Electrocardiography reveals non-sustained ventricular tachycardia. Which of the following is the most appropriate next step in the management? And the options are: initiate antiarrhythmic drug therapy, B. Perform alcohol septal ablation, C. Perform implantable cardioverter defibrillator placement, and D. Refer for cardiac transplantation. The answer is C. Perform implantable cardioverter defibrillator. Let's see how. So this is the management of hypertrophic cardiomyopathy. Firstly, see whether the patient is asymptomatic or symptomatic. If the patient is asymptomatic, do a serial evaluation and there is no emergent management that is required for this patient. But if the patient is symptomatic, the first line drug that has to be started is a beta blocker or a non-dihydropyridine calcium channel blocker. What is this going to do? These drugs are going to reduce the heart rate and thereby increase the diastolic filling time. So increasing the diastolic filling time is going to fill the ventricles with sufficient blood so as to prevent the left ventricular outflow tract obstruction from intensifying or obstructing more. If the patient is still having persistent symptoms, then you can add an antiarrhythmic drug which is called as disopyramide. It has a negative inotropic effect, thereby reducing the ventricular contraction. If still the patient is having symptoms, then see whether the patient is having severe LV dysfunction. If the patient is having severe LV dysfunction, then do a cardiac transplantation. But if the patient is having severe LVOT obstruction, or if the patient is still refractory to the medical management, then what you can do is a septal myomectomy. This is a surgical modality of removing the bulge of the interventricular septum that is forming LVOT obstruction. If it is not possible, you can also go ahead with alcohol septal ablation, where you inject alcohol into the coronaries which supply the interventricular septum. So there is selective infarction of the areas of the septum which is obstructing the LVOT, thereby the obstruction is relieved. And in any case, if the patient is having high risk for sudden cardiac death, one such is any history of ventricular tachycardia, what you can do is place an ICD, right? What are the drugs that you want to use cautiously or the drugs that have to be avoided? These are the drugs that reduce the preload and increase the ventricular contraction. The drugs which reduce the preload are nitrates and diuretics, whereas the drugs which increase the contraction are the digoxin. Right? A vigorous exercise should also be prevented because vigorous exercise will demand more from the heart and left ventricle will have to contract more for pumping the blood to the muscles. That is why a vigorous exercise should also have to be avoided.